I did not go to the movie with my sister. We're not going, and we didn't.
No, you stay home. If you have to go out to the store, you know what to do. I told you already, right, George?
Right.
You stay away from everybody.
Right.
Wash your hands how often?
Often.
Often, often, often. Otherwise, just stay in.
I loved your video. George sent it everywhere. So
Thanks, George.
Yeah.
Spread the message.
He did. He did.
She works in healthcare?
Yes. And they sent her home and they want her to get a note
When did they send her home?
today.
What are her symptoms?
She's just sneezing. She's not coughing, she's sneezing. She has watery eyes, no temperature. They check her temperature when she walks through the door. And they want her to get a note saying that she's cleared to go back to work.
So we won't be able to clear her to go back to work if she hasn't had the testing, but she won't meet criteria for testing at all. So that's at the discretion of her employer. If they think it's appropriate to send her home, then she'll have to stay home.
So either way, she's quarantining herself. Like she has to isolate herself. Or
You know, that doesn't sound like somebody typically that might need
that
to
might
isolate,
have it. Right.
but in this case, that's at the discretion of her employer. Yeah.
Yeah.
We're sending, upon request, the 2 hospital ships. They're being prepared right now.
That's to expand hospital beds,
They're in top
basically.
shape. They soon will be. They're getting ready to come up to New York. Earlier this week, the first clinical trial of the vaccine candidate for the virus began in Washington State, as you probably know. The genetic sequence of the virus was first published in January, but thanks to the unprecedented partnership between the FDA, NIH, and the private sector, we've reached human trials for the vaccine just 8 weeks later. That's a record by many, many months.
Regarding the vaccine, even though they think that it's getting closer, that's still many, many months away before that would be deployable to the population. Many, many months. More like end of the year.
But we're going to see if we can do a self-swab, which would be a lot more popular, I can tell you that. So,
Yes, that would be very popular.
administered also by a health official.
That's
but
not an easy
a lot
swab to
easier
do, to get it up high enough into your nose.
And this afternoon, I'll be meeting with nurses on the front lines of the battle against the virus. They're truly American heroes. They want to get it done. They're incredible people. So we're going to be meeting. And now it's our time. We must sacrifice together because we are all in this together and we'll come through together. It's the invisible enemy. That's always the toughest enemy.
He's right, we will be able to move through this as quick as we can, only if we all take precautions. 100%. Any luck on N95 masks at this point? I got, yeah.
The sheet that I gave you from Mr. Sullivan.
We're not the only ones that are having some struggles with getting those masks. Isn't there a National Guard armory in town? I would hate for us to go through this whole thing and then 3 months from now somebody finds a warehouse full of N95 respirators and that have been sitting there for years. I don't know. Call the military and see if you can find N95 respirators that they're not using. The screening site is still not up and running, and they don't think it'll be, I don't know, I think it'll be into next week before that's really up and going. So for now, still no easy access testing, and you have to be seriously symptomatic to get the testing done. Closures in the state of Florida. Governor DeSantis, right, yesterday, 5 o'clock for nightclubs and bars. You know the reason for that. Spring breakers. There's also some restrictions with the beaches and all of this. I think it's the smart move, so I'm glad to see the governor stepping up. Still no positives in this county. Pretty amazing. I just got that text about 2 hours ago from Mark Lander. Still no positives. And he'll be the first to know as the top health department official in the county. So still nothing yet. Any minute in our county. Locally, a bunch of stores are starting to close up. The businesses are becoming affected locally as well. People are losing their jobs or getting their hours cut. Moms and dads are having to stay home with kids. So this is affecting a lot of people. We must move through this as fast as we possibly can. I want to remind everybody in this room and everybody that's watching, and business owners and managers that are watching, anybody that's feeling unwell, feeling sick, developing a cough, feeling viral, has a fever, go home. Nobody's feeling like that right now, are they? While we're all crammed in this room together?
Not yet.
Specimen collection, we talked about the sites here. They still don't have the one up and running. In the Trump press conference that we just watched, he mentioned that they're working on a self-collection method, which would be great. That's weeks and weeks and weeks away before they could get something like that out to a person. I'm waiting for Trump to cough one time.
I know.
It'll close the whole country down if he coughs one time. Everybody pump on the way out.
You wasted it!
It'd be good if you could just like wear this as a necklace so you can
Just let her dump it on herself.
treat on St.
St.
Patrick's
Patrick's
Day.
Day night on Bourbon Street in New Orleans.
Oh,
Ghost town.
Yeah,
good for New Orleans.
Ghost town.
Ghost town. That's awesome.
That is awesome. That's what we need to do. That. We need to do that local.
The Lowe's on 90th, Southwest 90th, is already working with another hospital that they're not even going to get any in. They're just going straight to that hospital.
The Lowe's is already working with another hospital.
Southwest 90th from the warehouse.
The hospitals are ordering respirators from Lowe's.
Lowe's.
Wow. This is going to be tough to get respirators.
Okay, so I reached out to the National Guard like you wanted, contact the military.
Okay?
I spoke to Sergeant T. He advised that they don't have any N95 respirator masks. They don't have them, but he is reaching out to his higher ups to get me a point of contact in the clinic that might be able to direct me or
Okay.
try to help us in some way.
Excellent. Good. Let's keep up with that. If we can get some respirators, then we'll be able to get some testing going.
So called the mayor. He is going to email me all of the information from last night's meeting.
Let me know. Thank you. That's good work on N95. Hopefully the military will pull through.
Maybe they will.
We've been lucky because the virus hasn't really spread in our area. There are places in the United States that are getting hit so hard. It's coming. Make no mistake, it's coming here. Mitigation is everything. You can be a carrier of this virus for 5 days and not know that you have it. You can be out in public spreading it around to people. That's the scary part about this. So let's say that I'm infected and you're not infected, and you're gonna deliver me food. I may have just infected you. So what do? We both go wash our hands. I'm asymptomatic, so I don't know that I'm infected. I didn't know that I'm giving it to her. That's the precautions. We both have to wash our hands. Exchanging money.
And he just touched my thumb. Oh God, I'm infected.
This time you're infected and I'm not, so you just gave it to me. But how do I stop it? Go wash my hands. Here, let me have the mail. I'm infected. You're infected. I put my hands on a surface, debit card machine at the store. Wash your hands, wash your hands. Every door you open and close, everywhere, assume that it's infected. Wash your hands in and out of every building. Phone, hand sanitize my phone, will you?
Sure.
Thank you. Actually, this was probably a mistake.
Sherwin-Williams didn't even let me finish my sentence and was like, nope, completely out, everywhere around
Paint supply.
here, gone. However, I did get in touch finally with Harbor Freight, and she said that if I called tonight between 7:30 and 8 o'clock, the manifesto will be there and they'll be able to tell me how many. And she said the truck comes in at 8 a.m. tomorrow. So if I'm there, first come, first serve, they won't put any aside even for a doctor's office. It's just, you gotta get there.
First come, first serve. Otherwise, every other warehouse, Ace and Lowe's and all the warehouses, all the hardware stores are cleaned out. If the stars align, a couple drops of unicorn blood and we'll get respirators maybe as early as tomorrow.
Hopefully.
Wait, I invented a new thing.
Okay.
Oh. It's the hand sanitized fist bump. Okay, today we keep the press on. Still working on respirators. Specimen collection testing sites in the area are still in the works, but not yet up and running. Everybody must follow these mitigation practices. If you want your bars and your restaurants and your nightclubs open again, if you want to get back to work and get back to school, the only way that's going to happen is when the spread of the coronavirus has stopped. Mitigation is the most important thing. Keep yourself safe and you keep everyone safe. Let's sign off.